Hello everyone, and welcome to our YouTube channel. Let's start by discussing the prevalence of stroke in the United States. Can you give us an overview?
Certainly. Stroke is a significant health issue in the United States, with millions of people affected each year. Approximately 7 million Americans have experienced a stroke, and there are around 795,000 new stroke cases annually.
Are there any particular regions in the United States where stroke incidence is higher?
Yes, certain regions, often referred to as the stroke belt, have higher rates of stroke incidence. This includes states like Alabama, Mississippi, and Louisiana, where risk factors such as hypertension, obesity, and smoking are more prevalent.
How does stroke impact healthcare systems, families, and caregivers?
Stroke has a wide-ranging impact. From a healthcare perspective, it places a significant burden on hospitals, rehabilitation centers, and long-term care facilities. Families and caregivers also face challenges as stroke survivors often require ongoing support with daily activities and rehabilitation. This can lead to emotional, physical, and financial strains on the caregivers and the overall support network.
Moving on to treatment and rehabilitation, what are some recent advancements in stroke care?
There have been notable advancements in stroke treatment and rehabilitation. For instance, the development of thrombolytic therapies, which can dissolve blood clots, has revolutionized acute stroke management. Additionally, neurorehabilitation techniques, such as constraint-induced movement therapy and virtual reality-based interventions, have shown promising results in enhancing recovery outcomes.
That's fascinating. Can you explain the importance of interdisciplinary teams in stroke management?
Interdisciplinary teams play a crucial role in providing comprehensive stroke care. This includes neurologists, physical therapists, occupational therapists, and speech-language pathologists. Their collaborative efforts ensure a holistic approach to address the diverse needs of stroke patients, resulting in optimal recovery and improved quality of life.
How do post-stroke rehabilitation programs contribute to the recovery process?
Post-stroke rehabilitation programs are essential for promoting recovery and restoring functionality. They encompass various therapies such as physical therapy, occupational therapy, and speech-language therapy. By tailoring the rehabilitation process to individual needs, these programs significantly improve the overall well-being and independence of stroke survivors.
Shifting our focus to prevention, what role do lifestyle modifications play in reducing the risk of stroke?
Lifestyle modifications are key in mitigating the risk of stroke. Adopting a healthy diet, engaging in regular physical activity, and managing risk factors like hypertension, diabetes, and obesity can significantly lower the chances of experiencing a stroke. Additionally, quitting smoking and moderating alcohol consumption are important preventive measures.
Are there any other preventive measures individuals can take?
Certainly. It's crucial to monitor and control key risk factors. Regular checkups and managing conditions like high blood pressure, high cholesterol, and diabetes are important steps. Following prescribed medications, such as anticoagulants or antiplatelet drugs, can also reduce the risk of stroke. Being aware of the signs and symptoms of stroke and seeking immediate medical attention is vital as well.
Are there any disparities in stroke incidence and outcomes among different populations?
Yes, there are disparities in stroke incidence and outcomes. Certain racial and ethnic groups, including African Americans, have been found to have a higher risk of stroke. Studies have shown that African Americans have a higher incidence of stroke compared to other racial and ethnic groups. This can be attributed to various factors, including a higher prevalence of risk factors such as hypertension, diabetes, and obesity in this population. Socioeconomic factors, limited access to healthcare, and disparities in healthcare quality and treatment outcomes also contribute to these disparities.
That's concerning. How can we address these disparities and improve stroke outcomes for marginalized communities?
It's crucial to address the underlying social determinants of health and improve access to quality healthcare services. This can be achieved through community outreach programs, health education campaigns, and initiatives that focus on preventive care and early intervention. Additionally, healthcare providers should strive for cultural competence and inclusivity in their practices to ensure equitable stroke care for all populations.
Are there any promising research areas or emerging technologies in stroke management that you find particularly exciting?
Yes, there are several exciting research areas and emerging technologies in stroke management. One area of interest is the use of telemedicine and remote monitoring to enhance access to stroke care, especially in rural or underserved areas. Artificial intelligence and machine learning algorithms are also being explored to improve stroke diagnosis, prediction of outcomes, and personalized treatment approaches. Additionally, advancements in neuroimaging techniques and genetic research hold promise for better understanding stroke mechanisms and developing targeted therapies.
That's fascinating to hear. Lastly, what advice would you give to our viewers to promote stroke awareness and prevention in their communities?
My advice would be to prioritize your health and well-being. Stay informed about stroke risk factors and warning signs, and encourage regular checkups and screenings. Adopt a healthy lifestyle with a balanced diet, regular exercise, and stress management. Spread awareness in your community through educational initiatives and support organizations that promote stroke prevention and provide resources for stroke survivors and their families.
Thank you for sharing your expertise and insights with us today. We appreciate your valuable contributions to the field of stroke management.
Thank you for having me. It was a pleasure discussing this important topic, and I hope our conversation helps raise awareness and make a positive impact on stroke prevention and care.